I'm a dentist and the director for the Community Dental Clinic. The Community Dental Clinic was started in 2009 here in Owensboro just by some local community members. They realized that there was just a huge need for oral health care, particularly for people with Medicaid and the lower income people of our community. There were cases of just large numbers of people going to the emergency room with toothaches. Really not the place where we want that care to be delivered. We want that delivered in an office, and there just weren't any available Medicaid providers or providers that provided an option for low-income individuals. Here at the Community Dental Clinic, we have service. We're approaching over 14,000 patients. We have 2 dentists and 2 hygienists and several staff members that all deliver numerous areas of care, so oral surgery, fillings, cleanings, just about anything you can find in another dental office we try to provide here. For example, last year alone we extracted over 2,600 teeth, so we provide a lot of oral surgery. We see a lot of small children all the way up to any age adult. When we were all trying to figure out what we're going to do, what are our next steps, the challenge in dentistry was some of the procedures that are done in dentistry can actually be considered some of the most dangerous procedures in medicine just from aerosol production. And so initially the governor of the state restricted all care to emergency only and encouraged dentists to provide teledentistry as much as possible. Now, teledentistry was new to the state of Kentucky. It was never legal until COVID-19 occurred, and those regulations were passed through really quickly. And so in our office alone, we had a lot of concern. We knew that a lot of our patients are walking around with issues that could put them in harm's way very quickly and easily. So just in our office during the pandemic, we served over 72 patients utilizing teledentistry. And so what we're able to do, the patient would call, leave a voice, and we would call that patient back, encourage them to take a picture of the area that was bothering them. And then once we had that photo, we were able to call in antibiotics. And so just those 72 patients alone, we were able to keep those patients out of the emergency department, which is always a primary goal of our office. And then we had numerous conversations with other patients who just had questions and just kind of unsure and really what their next steps were, and we were able to take care of that as well. So, and as I mentioned before, dentistry, again, with the aerosols that are generated, we all know that this virus can be carried in these really tiny droplets, and those droplets can float throughout the air. And so anytime you do something like run a drill that really aerosolizes, creates lots of those droplets floating around everywhere. And so we needed to do something to address that, just to protect our staff as well as protect the patient. So part of what we do is we wear a lot of personal protective equipment. Another thing with the COVID-19 response fund that was just a godsend for us was we were able to secure these units that have HEPA filtration, and they have an articulating hose that comes right up to the patient's mouth. And so the entire time we're working, this vacuum is working to remove those aerosols, filter those completely out, and then just release clean air. So all the personal protective equipment we wear combined with the filtration devices, the Vandeman filtration devices that we purchased, we feel that our office is one of the safest offices in the area. And as I mentioned, that personal protective equipment that we're wearing now, a lot of that is new. It's different. We've never worn it before. So traditionally, we would spend about $1 per patient on personal protective equipment. That cost, we estimate, is up to about $20 per patient. And so with us seeing a large volume of patients, because we have so many people in our community with need and we're frequently the only provider that they can see, we anticipate that even at half volume, seeing half the number of the patients that we normally see, we're anticipating about $96,000 per year increase in personal protective equipment. If we were to go up to numbers a little bit closer to where we were before, you're anticipating more like $153,000 in just cost for personal protective equipment. Some offices that see private dental insurance, private patients, they're able to pass some of that cost on to the patient, but Medicaid actually prevents us from having any sort of cost sharing or charging a fee for that protective equipment. So thank you to everyone who's contributed to the COVID-19 Response Fund. You're making it possible for us to stay safe, keep the patients safe, and take care of their needs all at the same time.